When George Bush came in as president of the United States, he said to me and to my department, and Reuben was in the Department of CMS at that time, and we changed CMS. How many of you in this room remember the old HICFA? Does anybody remember HICFA? HICFA was the name of CMS. Everybody hated HICFA. The Catholics, the Baptists, the Communists, the Republicans, the Democrats, everybody. And I did something completely different when I was secretary. I went out and actually ran each individual division. And I went out to HICFA. And I sat in the administrator's office. And on Friday afternoon, I still remember, about 800 people from HICFA came there. And I said, I want to tell you something. Nobody likes you. You don't answer your mail. You don't answer your telephone. It takes you 110 days to respond to a congressman, and they're your bosses. Can you imagine? 110 days was the average. And I said, you know, I was on Capitol Hill. The Republicans don't like you. The Democrats don't like you. The one socialist, Bernie Sanders, he doesn't like you. And I said, how can anybody like a HICFA? And I said, we're going to change the name. And Tom Skelly and Reuben King Shaw and myself sat down, and we gave it the new name, Centers of Medicare Services. There were all kinds of lawsuits that were against the old HICFA. We changed that, and there are hardly any lawsuits. Nobody really complains anymore about CMS. The name change made a tremendous difference, but also the people started responding. They started answering the letters from congressmen and women, and they started answering the telephone. People call up and get questions answered now, and nobody really complains. And there are no pending lawsuits by governors or other people against the old HICFA, now the CMS. Why do I tell you this? I tell you that because things can be fixed. And when George Bush came in, if you all remember back then, during that period of time in the election, what was the big problem by the elderly in the United States? They didn't have enough money for their prescriptions, right? There are a lot of seniors, you know, that everybody was on the air. Democrats and Republicans were trying to take advantage of that. And they said, oh, the seniors have to cut their pills in half. Remember those ads, you know, and Uncle Joe and Aunt Minnie, they don't have enough money, they have to cut their pills in half. And George Bush comes in, the election, very close election, remember, a few court battles in order to get there. And what happened? He came in and he instructed the Department of Health and Human Services, Tom Skelly, Reuben King Shaw, Tommy Thompson, and others, to come up with a new program. And the beauty of it is we were able to develop a whole new program that nobody even thought could actually work. We didn't know it was going to work. You know, we had to come up with medicine, we had to come up with money, we had to come up with ways in which we were going to distribute the particular program. And I didn't know it was going to work. None of us did. We hoped and prayed that it was going to. And we set up Part D, the drug policy under the Social Security Act. And we came out with Part D. And if you remember correctly, we had that donut hole. And the Democrats were going to kill us in the next election. I don't know if you remember this. Sort of like go down history lane. And they were going to make sure that everybody that was a Republican was going to get defeated. Bush was up for re-election. And everybody thought, you know, it was going to get out. Hugely controversial. But then after the election, something happened. Part D was working. And seniors, 90% of the seniors in America endorsed Part D. Now I want you to know, there's a lot of seniors, and I'm a senior now. You cannot get enough seniors to get together in a community, 90%, to agree upon free ice cream and apple pie. You know that. But right now, 90% plus of the seniors believe in Part D. And that's why it was never changed, because people said, it is working. And that's why today we're here on a whole new program. Fraud and abuse. Fraud and abuse has taken over the system. When I started as secretary, we recovered for the first time in 2001, $1 billion. And I can remember Congress was really excited about the fact that we picked up from the Department of Health and Human Services $1 billion. And we thought, we were getting a handle on it. The problem is we got smarter as the government. But the people committing the fraud are a heck of a lot smarter and faster and more adept and better than we are. And there are gangs of individuals, mafiosa, whatever you want to call it, all over the world. There's a gang in Eastern Europe that has a determination as to how long they can set up an artificial phantom billing, as Bob has talked about, can set up in a community in your particular state. How long they can set up and bill patients from that particular site before CMS finds out about it. They actually know how many visits, how much they can bill, and get away with it and walk away with it. That's how sophisticated they have become. And so, we have to do something about it. It affects all of you. I don't care if you're a payer, a provider, a government agent, a government individual, just a plain taxpayer. $400 to $500 billion, and we don't even know the full extent of it. And we all wait till after the fact. And these people in Eastern Europe who have got this so sophisticated, and they have the logarithms know how long they can bill and get away with it, you're not going to stop them unless you do it at the beginning. And that's why MedicFP has come forward. And that's why Bob and his partners and Reuben, myself and Matt Kennedy, can you imagine a Democrat and a Republican like Matt Kennedy? And Tommy Thompson. Getting up here and saying, now this is good. This is good. And so you have to get it before your money is sent out or we'll never stop it. And Medicare fraud prevention is where it is. And so today, I wanted to set the stage because we can do something about it. But we got to be willing to do it. And we got to, figure out a way in which we're going to be able to implement MedicFP across the country. And that's why Reuben flew in today. And that's why I flew in from Wisconsin last night. And it took me all night to get here. Thank you, Bob, for having me. But we're here today to answer your questions. And that is why I am so excited about this, because I know it works. I know we can do something. And I know we have to do something. And I love it just going back to Part D, starting something new and making it work. And that's why all of you are here to listen, and that's why I'm here to talk about it, and hopefully together we can make this happen.